Hi, my name is Julia Smith, and the career that I chose is a child life specialist. A child life specialist is someone that is with the family and the child when they're having medical procedures done. I don't know anyone in this field, but I have seen it in action. A few years ago, my son was in the hospital, and in the room next to him was a little girl who was terminal. She was in great pain, and there was a woman that was talking to the family about what the doctors wanted to do to help relieve her of her pain and the stress in her last few days and hours. As they wheeled this little girl from her room to the intensive care, I watched this woman give encouragement and love to this little girl and the family. At the time, I wished that there was someone there that could help me understand what the procedures and tests were going on with my own son. But because there was an entire floor full of sick children, there were just not enough child life specialists to do that. So I want to be one of those people. The work environment is anywhere from inpatient units like we were in to surgical units, emergency rooms, intensive care units, outpatients, community outreach programs, private medical and dental offices, and even special needs camps. Because of the different types of working places that you would be, you can be very flexible in what you want to do and your hours that you spend. Obviously, the hours in an emergency room would be different from a special needs camp. The hours in intensive care would be different from a dental or a medical office. It depends on what you want. The job is very competitive, and so if you want a job many times, the new child life specialist has to relocate. What they do is they help prepare children and families for medical procedures and treatments by learning coping skills to treat anxiety. They provide distraction during medical practices. You need to be innovative and patient with not only the patient, but the families. It's done by using medical play, therapeutic play, surgical play, and any other exercises in play that will help relieve the anxiety that's going on. You also help the child's siblings, and the child's family understand the changes that are going on in their own lives and how to cope and how to help each other out. You also provide consultation for the healthcare workers so that they know more about the family and the child so that they can be more beneficial to them. It's a stressful job if you take things personally and internally, which would be very difficult not to do, because working with terminal diseases in children and helping them through these painful procedures would be heartbreaking. Keeping everyone calm takes practice, and you would have to have diversity all throughout the day. Every case would be different, and maybe minute to minute. Working with frantic and stressful parents so that they don't scare their child, working with a scary child, and working with healthcare providers so that they make sure that they have all of the information that they need are all parts of this job. The educational requirements are at least a bachelor's degree and 10 hours of classes in child life practices, child development, communication, family relations, diversity, and family competence. Then you must take the certification exam and have 480 hours of an internship. Then, on top of all that, after all of it's done, you can make a total with benefits of $69,000 a year. It's not much, but knowing that you've done a job well and helping families would be the blessing.